Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. For some reason, a big topic on hair loss forums and subreddits is that people are suddenly declaring that Dutasteride doesn't work. Of course, as you might expect, nobody who makes these claims ever has any photographic evidence to back it up, but we nevertheless are hearing more and more anecdotes of people saying they're losing hair on Dutasteride, or they'll say the switch from finasteride to Dutasteride is causing an acceleration of their hair loss. It's remarkable how so many people on hair loss forums and subreddits claim they're losing hair on finasteride or Dutasteride, but not a single one of them can provide any photographic evidence whatsoever. I'm not the one to tell the moderators of Trestless how they should run their subreddit, but maybe they should at least consider implementing a rule where if someone wants to claim that finasteride or Dutasteride is making their hair loss worse, they should have to actually provide a before and after picture that is timestamped to prove it. Perhaps that would cut down on some of the bullshit and trolling that I suspect is going on with this topic. But seriously, what is going on here? How is something like this even theoretically possible? First, let me state the obvious. Dutasteride is stronger than finasteride, plain and simple. Even though Dutasteride is not FDA approved to treat hair loss in the United States, unlike finasteride, we know Dutasteride is still a stronger blocker of the 5-AR isoenzymes compared to finasteride. There are several studies comparing the chemistry of the two compounds, such as this study here. In this study, the authors say, quote, the IC50 for the type 1 5-alpha-reductase is 0.7 and 81.0 nanomoles for Dutasteride and finasteride respectively, and for type 2 5-alpha-reductase, 0.05 and 0.16 nanomoles respectively, unquote. Now, what IC50 means is the concentration of the drug that causes a 50% inhibition of the 5-AR enzyme. By measuring IC50s, it is possible to compare how powerful different drugs are, and if you want to know more about the use of IC50 and other measures to compare drug efficacy, you should watch my video comparing different topical anti-androgen receptor blockers, which I'll link below. But using my Witcher senses to translate these IC50 results into something more comprehensible, it means that Dutasteride is about 100 times stronger than finasteride at blocking the type 1 5-AR isoenzyme, and it is also about 3 times stronger at blocking the type 2 5-AR isoenzyme compared to finasteride. Because Dutasteride is a stronger blocker of both the type 1 and type 2 isoenzymes than finasteride is, Dutasteride has more of an effect on both serum and scalp DHT levels than finasteride. In the study that compared the two drugs, it was found that if you compare a dose of 0.5 milligrams daily of Dutasteride versus 5 milligrams daily of finasteride, you'll see that serum DHT decreases around 90% with Dutasteride and it decreases around 70% with finasteride. Scalp DHT decreases by 51% with Dutasteride and by 41% with finasteride, as you can see here. This may not sound like all that much, but both drugs are still clinically proven to stop hair loss in the vast majority of people who use them. This is reinforced in this same article where hair growth was looked at specifically. It was clear that both 0.5 milligrams and 2.5 milligrams of Dutasteride showed superior hair growth when compared to 5 milligrams of finasteride. Now, this was a pretty large randomized controlled study of 416 men, but in case there is any doubt in your mind about the superiority of Dutasteride to finasteride, we have this more recent study here from 2022. This study is from Good Korea, so you know it is a high quality study, and I am not being facetious here. For some reason, Good Korea is where the majority of quality hair loss research comes from. It's also worth mentioning that unlike in the United States and Europe, Dutasteride is approved for hair loss in Good Korea. Anyways, in this study, 600 men who had been prescribed either Dutasteride or finasteride for androgenetic alopecia were retrospectively compared. In the study, the investigators used a classification of hair loss called the Basic and Specific Classification, or the BASP classification, which is much more detailed than the standard Norwood-Hamilton classification most of us are already familiar with. In any case, the study found that overall, 0.5 milligrams of Dutasteride a day was more effective than 1 milligram of finasteride per day. Despite Dutasteride being a stronger 5-AR blocker than finasteride, the incidence of side effects was the same or even a bit lower on Dutasteride versus finasteride. This may seem pretty strange considering Dutasteride's greater potency, but other studies have also shown this, and I talk about this in more detail in my video on the truth about Dutasteride side effects that I'll link below. And it also may explain why some people who get side effects on finasteride make the switch to Dutasteride and don't get those side effects. Getting to the point of this Good Korean study though, both drugs were overall well tolerated with very few study dropouts. This was over an average treatment duration of 3.5 years. So dutasteride is stronger and more efficacious than finasteride, but how long does the effect last? Does it last forever like finasteride does? That isn't hyperbole. Finasteride does last forever so long as it is used early enough in treatment, and I have a video where I show this, which is linked below. But does this also apply in the case of dutasteride? Well, as I discussed in my video on finasteride lasting forever, there have been several studies done that show excellent long-term finasteride results, including 5 and 10-year follow-up studies, such as this study right here from Italy. These studies indicate that finasteride maintains its efficacy over time. In fact, in this particular study, there was continued improvement in results even after 5 years of treatment. With dutasteride, we don't have as much long-term data, and that might be because dutasteride is not FDA approved for hair loss. The study I just quoted about efficacy had, like I said, an average treatment duration of 3.5 years. In studies using dutasteride to treat benign prostatic hyperplasia, there is a slightly longer follow-up, such as this study here, which had a 4-year follow-up. This was a very large study of 2,802 men. In the study, DHT levels were measured in the first 2 years, and the DHT suppression stayed at least at the 90% level over time. It's also interesting that, like with finasteride, most of the side effects occurred in the first year of the study, and then the incidence of side effects decreased over time. As you guys know, I often say that even if side effects do happen to you, you should try to push through for at least a few months, since there is a good chance that such side effects will subside on their own, and this is backed up by plenty of scientific data I've gone over in other videos. So, there's no evidence that dutasteride's benefits diminish over time, and the evidence shows that side effects are rare, but even if they do happen, they usually go away on their own with continued use, just like with finasteride. One advantage finasteride has over dutasteride is we have more research on it as a hair loss treatment, in addition to having more long-term follow-up data on dutasteride compared to finasteride. For that reason, I generally recommend people start with finasteride first and not immediately join the dutasteride master race, especially if you're getting into the game early. If you're a Norwood 3 and beyond though, and you want to maximize your chances of regrowth, then perhaps joining the dutasteride master race is the best course of action. But for prevention, both dutasteride and finasteride are perfectly adequate. I'm not taking a side though, so dutasteride master racers, please do not flame me. My only point is that both drugs are excellent at stopping hair loss, and you should be on at least one of them. But let's talk about the people on Trestless claiming they're losing hair on dutasteride. So, knowing that dutasteride is stronger and more effective than finasteride, why in the world would anyone do worse on it than they do on finasteride? Well, let's go over and dismiss the bro science we commonly hear in the forums, and then I'll propose some theories of my own that are more grounded in actual scientific evidence. The first theory that always comes up is what's called reflex hyperandrogenicity. This theory claims that because dutasteride blocks more DHT production than finasteride does, it causes a greater increase in testosterone levels than finasteride, and that this increased level in testosterone interacts with the androgen receptors in the hair follicles and directly causes hair loss. In this theory, testosterone substitutes for DHT and takes over its bad guy role in causing hair loss, and since 5-AR inhibitors don't block testosterone, they become ineffective for hair loss. This theory rests on the hypothesis that any androgen can cause hair loss, not just specifically DHT, and since dutasteride raises testosterone, even more so than finasteride does, that means dutasteride can cause hair loss. Well, with all due respect to my friends on Reddit, this theory is complete bullshit. We know this because the research on 5-AR inhibitors is based on the physiology of men born with a 5-AR deficiency as originally described by Dr. Julianne Imperato-McGinley back in the 1970s. As Dr. Imperato-McGinley described in her research about these men, quote, "The biochemical abnormality in affected subjects with 5A reductase deficiency is characterized by normal to high concentrations of plasma testosterone with low to low normal concentrations of plasma DHT, resulting in an increased testosterone to DHT ratio," unquote. Yet despite increased testosterone levels, none of these men showed any signs of hair loss whatsoever. They were all Norwood 1s. To quote Dr. Imperato-McGinley again, quote, "Temporal recession of the hairline does not occur in affected male adults and appears to be mainly mediated by DHT," unquote. If we go back to the earlier study that we looked at that examined changes in serum and scalp DHT levels with finasteride and dutasteride, that study also looked at changes in serum testosterone levels with the two drugs. Let's take a look at this graph here. In this graph, 5 milligrams of finasteride is represented by the open circles, and 0.5 milligrams of dutasteride is represented by the open triangles. For the first 6 weeks of treatment, the increase in testosterone levels is only slightly higher with dutasteride versus finasteride. Dutasteride at 0.5 milligrams per day causes peak testosterone levels at 12 weeks, after which both drugs show a decline in testosterone levels back towards baseline levels. This is interesting data because in my last video on how to mitigate finasteride side effects, I made the claim that the increase in testosterone levels with finasteride is an acute effect that gets better over time. This goes along with the evidence that finasteride side effects resolve on their own over time. This graph is yet another validation of that theory. There's more data on the effect of dutasteride on serum testosterone levels, this time coming from a study on people treated with dutasteride for benign prostatic hyperplasia, also known as BPH. The study found that the free serum testosterone levels were on average 20% higher than baseline levels after 1 month of treatment with dutasteride at 0.5 milligrams daily. This is in contrast to finasteride, which raises serum testosterone acutely somewhat less by 10 to 15%. When the investigators broke down the subjects into those who had more than a 20% rise in free testosterone levels and those with less than a 20% rise, they found that baseline testosterone levels were lower in the group with the greatest rise. But not only that, the quality of life improved the most in men with the greatest testosterone rise, which makes complete sense. Testosterone is the alpha-chad hormone after all, and what could be better than raising the alpha-chad hormone testosterone while suppressing the beta-virgin trash hormone DHT? We should all consider ourselves very fortunate we're living the era where 5-AR inhibitors are so readily available. But I'm sure someone is typing in the comment section right now, "But Kevin, if dutasteride does raise testosterone more than finasteride, wouldn't that still be reflex hyperandrogenicity, and wouldn't that still cause hair loss?" Well, the ultimate reason why reflex hyperandrogenicity causing hair loss is bullshit is the fact that DHT doesn't interact with the androgen receptor the same way as testosterone does. The effects are different, and it is a qualitative difference, not just a quantitative difference. More important than the potency of DHT is the fact that, quote, DHT binds to the androgen receptor, inducing conformational changes that are different from testosterone activation of the androgen receptor, contributing to different effects of testosterone and DHT, unquote. That's right, DHT activates different gene transcription when it binds to the androgen receptor than testosterone does, which is why DHT causes hair loss and testosterone doesn't. After all, there is no other duplication of hormones in the body. Each hormone in the body has a specific role, even the trash hormone DHT. That's why it wouldn't make sense that DHT would have the same role as testosterone, only stronger. If DHT was just a stronger version of testosterone, then why wouldn't the body just make more testosterone when it was needed, like during fetal development in adolescence? It's because DHT is not just a stronger form of testosterone. It is a different hormone than testosterone with a different role in the body. It is clear from the recent research that DHT has different effects from testosterone, even though they both activate the same receptor. In the case of adults, DHT is a trash hormone where one of these different effects is to cause hair loss. It does other things in adults too, and all of them are bad, including causing an enlarged prostate and acne. The bottom line here is reflex hyperandrogenicity is a fake condition that was just invented on the hair loss forums one day, and everybody went along with it for some reason. I went over this in great detail in my videos on reflex hyperandrogenicity and whether testosterone can cause hair loss, and I'll link those 2 videos below. Some of these theories on Trestless admit that it can't be testosterone worsening hair loss in people on dutasteride. Instead, they claim that the problem is the so-called backdoor pathways for DHT synthesis. These backdoor pathways are ways that DHT can be synthesized by means outside of the 5-AR enzyme, converting testosterone directly into DHT. The 5-AR enzyme is by far the most potent way our body produces DHT, but there do exist backdoor pathways that bypass the 5-AR enzyme. With these backdoor pathways, supposedly the upstream blockade of the 5-AR enzyme results in more DHEA or more progesterone, and this leads to DHT being synthesized by this backdoor pathway that you can see right here. This is an interesting theory, but there are 2 major problems with it. The first problem is one we already know, which is that dutasteride lowers serum DHT levels by 90%. So if the backdoor pathway is doing anything, it is definitely not resulting in increased DHT levels. Let me emphasize that again. There is literally no way imaginable for dutasteride dutasteride to actually raise DHT levels. It's not going to happen. The second problem with this backdoor pathway theory is that the type 1 5-AIR enzyme is actually one of the critical steps in the backdoor pathway, and we know that dutasteride, unlike finasteride, is a blocker of the type 1 5-AIR isoenzyme. So dutasteride should also block the backdoor pathways as well as the classical pathway for DHT synthesis. In fact, if any drug would allow more DHT synthesis by the backdoor pathway, it is finasteride and not dutasteride, since finasteride would only significantly block the type 2 5-AIR isoenzyme and not the type 1.
But Kevin, then that must mean dutasteride is bad because it is blocking all pathways from making DHT. So what about my neurosteroids? It's going to get rid of all your DHT, and that would probably be bad, right?
Well, keep in mind that the doses of finasteride and dutasteride that are used clinically are not high enough to block all DHT formation in the body. Also, although dutasteride is 100 times stronger at blocking the type 1 5-AIR isoenzyme than finasteride is, it is still a weaker type 1 blocker than it is a type 2 blocker. If you examine these IC50 values again, you will see that this is in fact true. So, you're not going to get excessive DHT levels from the backdoor pathway to cause hair loss on dutasteride, and you're certainly not going to hurt my neurosteroids on dutasteride either, and especially not on finasteride, which is 100 times weaker at blocking the type 1 5-AIR isoenzyme than dutasteride is. The neurosteroid thing, though, it's a separate subject entirely, so if you want to know more about that, I'll link my neurosteroid videos below if you want to learn more about that particular subject. So, I don't know what other theories people have on Reddit, but here are my theories as to why people report increased hair loss on dutasteride. By far the most common reason people likely report increased hair loss on dutasteride is that they're likely just going through a treatment shed and they're panicking because they don't understand that hair growth is a cyclical process. When you start a 5-AIR blocker, or if you change from a weaker 5-AIR blocker to a stronger one, you're going to get a shed. How severe the shed is not something that can be predicted, since it is based on how many hairs are in the telogen resting phase, which you can't just simply observe by looking at someone's scalp. For some people, the shed may not even be noticeable, but for other people, it can be severe. The important thing to remember, though, is that the shedding means the drug is working. If you are scared to start treatment because of a shed, then what do you think is going to happen if you don't go on treatment? Guess what? You're still going to shed, but this time the hair isn't going to come back. So if you're afraid to start treatment because of a shed, that's pretty damn stupid if you ask me. Just remember that shedding is a normal part of the hair growth cycle that everybody experiences. Even people who don't have androgenetic alopecia will go through periods of shedding. It's just a normal part of the hair growth cycle that can't be avoided because it is impossible to keep a hair permanently in the anagen growth phase. Frankly, I wish more doctors would go over this with their patients before prescribing them treatment, because literally 99% of the questions I get on this channel are all about shedding. Fortunately, I do have a video on shedding specifically, which I'll link below, so I recommend you watch that if you want to learn more about hair growth cycles and the whole shedding process. Anyways, my second theory also relates to people being impatient. Dutasteride has a much longer half-life than finasteride at 5 weeks versus just 5 or 6 hours for finasteride. It takes several half-lives to get to a steady state. With finasteride, that happens in a few days at most. With dutasteride, it could take weeks or even months. So it is possible dutasteride could take a little longer to flex its muscles compared to finasteride. But even in the case of finasteride, I have people tell me that they've been on treatment for like 6 weeks and they're panicking over it because they don't notice any changes yet. The hair growth cycle is a slow process, and the truth is it can take as long as 2 years before any noticeable differences occur. There are exceptions, such as in the case of hyperresponders, but hyperresponders are not the norm, so please be patient if you are on a 5-AIR inhibitor. Another possibility is people are just being fucking trolls. I know there is no way to verify this one way or the other, but I could totally see someone going to a hair loss forum and claiming that they're on the most nuclear stack possible and they're still losing hair just to cause panic in the community for the sake of the lulz. This is another reason why subreddits like Trestless should at least consider requiring photographic validation for people who make these claims. The final possibility relates to genetics. This study, which again is from Good Korea, looked at the genetics of men who were good responders and not so good responders to dutasteride. The investigators found multiple genes with polymorphisms, meaning variants. These variant genes included the SRD5A1 gene, which is the type 1 5-AIR gene. They also looked at the 3-alpha-HSD gene, which is the broccoli gene that is involved in DHT metabolism, which I'll explain further soon. Other genes with variants were the aromatase gene, which converts testosterone into estrogen, as well as genes involved in the retinol receptors and others. It's interesting that upregulation of the 3-alpha-HSD broccoli gene actually worsened the response to dutasteride and worsened hair loss. So much for the theory that explains everything, right? This is because the broccoli gene codes for a two-way enzyme, and upregulation of the enzyme actually increases DHT levels, which is what I pointed out in my video where I debunked the broccoli theory that Tesla still hasn't forgiven me for over 2 years later. I'll link that video below if you want to experience some of the drama yourself. So based on this study, I do think there may be some very rare cases of people who don't do as well on dutasteride than finasteride due to genetics, but it is probably very rare. But under no circumstance will dutasteride ever accelerate hair loss. Worst case scenario is that the drug will still work, but just not as well as it does for the vast majority of people. In that case, maybe 2.5 milligrams of dutasteride might be a preferable option. Overall though, the idea that dutasteride can make hair loss worse is completely bogus and not backed by any scientific data whatsoever. This is something that was never reported in any of the clinical studies done on dutasteride, which included thousands of subjects. Yet, all of a sudden, we're having people claim that dutasteride is making their hair loss worse. How is anybody believing this crap? It is all such complete bullshit and bro science, and it is a big problem with hair loss forums and subreddits in general since they don't moderate the spread of such misinformation. That's not to say that these places don't have any good information at all, but it is a shame that this kind of misinformation is left unchecked since it often outweighs the good information available on these forums. But that's what I'm here for, right? Hopefully, I put this all into perspective and you can take your finasteride or dutasteride in confidence knowing that you're doing the very best thing you possibly can to stop the slaphead curse. So, see you next time, my fellow hair loss switchers. God bless.